Telehealth Utilization Presentation by Emily Houston, Nursing 370, October 6, 2024. Certificate of Original Authorship. I certify that I am the sole author of this assignment. Any information in this assignment that is not my own is clearly documented. I use quotation marks appropriately. I cited any and all sources for which I use data, images, ideas, or words, either quoted directly or paraphrased using the APA 7th edition standards. I also certified that the information in this paper was prepared by me specifically for the purpose of this assignment, and I have not submitted any parts of this assignment to previous assignments. I understand that plagiarism policy of the Athens State and nothing in this assignment violates intellectual property laws. My type name below is intended to be the same as my signature on this document. Emily Houston, 10/6/2024, Nursing 370, Healthcare Informatics. Effects of telehealth application. The question states, explain the effect telehealth applications have on patients, providers, and regulators. So with patients, it's very cost effective. It helps reduce the American spending, so there's no higher net cost. So the patients don't have to pay additional prices to use telehealth. And usually you don't have to pay an additional copay, such as I've done telehealth before, and I didn't have to pay a $30 copay like I would if I was in person to see my provider. It decreases problems such as medication misuse, prolonged hospital stays, so it can the provider can defer the patient from unnecessarily going to the ER. Potentially they could go to the urgent care instead. It helps increase access to care, such as it does help reduce patient travel and wait times. It helps reduce the stress, because patients, their stress levels go up while they are waiting for an appointment with a provider. But with telehealth, they'll have the appointment within a matter of, days, and their anxiety can, help be reduced, and definitely increases the patient's satisfaction levels. Also, that will be mentioned under the providers, and with higher patient satisfaction levels, this can greatly, help providers when it comes to, obtaining bonuses, and just the overall, it improves the quality of care for the patient. So effects of telehealth application on the providers, it drastically reduces in-person visits and the risk of infection risk due to in person. If a patient is having flu-like symptoms and say they don't have a mask on, they go to the hospital or their provider's office and they're coughing and they're not washing their hands, they're touching things, touching their face, well, you're just spreading germs all over the place. But via telehealth, the patient's at home and they're not causing a risk to spread infections to other patients. And like I stated earlier, it definitely helps increase patient satisfaction levels for the providers, which will in return help the providers potentially pay raises. The continuity of care is definitely increased between the provider and the patient versus the patient being, some patients get seen every 6 months, once a year. So this way, yes, the patient might have more frequent visits with the provider, but the continuity of care will definitely be increased. The patients can continuously be monitored, evaluate and treat patients with non-urgent healthcare needs, and the provider could tell the patient, hey, you need to go to the urgent care for this issue, or you probably need to go to the ER for this issue. For regulators, the effects of the telehealth application definitely largely helps increase reimbursements for like Medicare And the benefits of utilizing telemedicine is greatly provided. There's so many benefits for this, for the regulators, and through the research it definitely explains itself. Telehealth, improving care access. The question states, describe the use of telehealth in ways it can improve care access to understand the remote population. So telehealth includes healthcare services providing using audio and video technology, such as you can use it on a phone, a cell phone, a tablet, and computer. Telehealth was originally developed to provide basic care to rural and underserved patients, such as patients that might not be able to afford health care in person because of copays, and to rural populations that might be hours away from a doctor's office and or hospital. Telehealth can improve care access to understand remote populations by it is very cost effective. You don't have to pay any additional copays, such as if you have like Blue Cross Blue Shield. Usually with Medicaid you don't have a copay, or Medicare. There are shorter wait times because normally if you make an appointment to see a provider, it could be weeks to months before you're seen, because the provider's has so many appointments they have to see face to face. But it decreases the wait time because it's on the internet using the tablet. It's very quick and easy, and there's no driving time, so the patient doesn't have to worry about cost of having to fill up a gas tank and driving maybe 30 minutes, an hour, 2 hours away to see their healthcare provider, and then driving all the way back. It is faster for access to specialists, because normally in the American population we have to wait sometimes months, but with telehealth it is very faster for us to use, like I said, telehealth to gain quicker access to specialists. It gives clinicians the ability to review and adjust care plans in real time, such as monitoring patients' blood pressure, and it makes it faster and easier to adjust medications. Patients can measure and securely transmit vital data directly to the provider. Like I mentioned before, a patient can check their blood pressure and submit it to the nurse for a review, and they can correlate the message to the provider, and then the patient can be responded to within that day of what the next further steps to do. References. Here are my listed references I used to complete this PowerPoint presentation. Thank you.